Welcome to Med Madness, your go-to source for medical knowledge. Today we're diving into the critical and life-threatening condition known as aortic dissection. Aortic dissection is a serious condition that every medical student and healthcare professional needs to understand. Early recognition and proper management can be life-saving. In this episode, we'll cover the definition, causes, symptoms, diagnostic methods, treatment options, and more. By the end of this podcast, you'll have a comprehensive understanding of aortic dissection and be better prepared to handle this condition in a clinical setting. Let's start with the basics. What exactly is aortic dissection? Aortic dissection occurs when there is a tear in the inner layer of the aorta, causing blood to flow between the layers of the wall of the aorta and forcing the layers apart. This can lead to severe complications and requires immediate medical attention. There are two main types of aortic dissection. Type A involves the ascending aorta and/or the aortic arch. This type is more common and more dangerous, often requiring emergency surgical intervention to prevent complications and death. Type B involves the descending aorta only, starting after the left subclavian artery. This type can often be managed with medication, unless complications arise that necessitate surgery. The most significant risk factor for aortic dissection is chronic hypertension. Other risk factors include underlying aortopathy, such as Marfan syndrome, Turner syndrome, and cocaine use, which can cause rapid increases in blood pressure. In aortic dissection, the inner layer of the aorta, known as the intima, tears, allowing blood to enter the medial layer and creating a false lumen. This can compromise blood flow to vital organs and lead to various complications such as aortic rupture, acute aortic regurgitation, and cardiac tamponade. Now, let's talk about how aortic dissection typically presents in patients. Patients with aortic dissection often experience severe tearing chest or back pain that is maximal at onset. They may also have a variation in systolic blood pressure between arms greater than 20 mmHg, and most are hypertensive on presentation. However, hypertension can suggest complications like aortic rupture or cardiac tamponade. A classic presentation includes acute chest pain that radiates to the back or neck. The pain is typically described as sharp and tearing. Other symptoms can include syncope, stroke, myocardial infarction, and acute aortic regurgitation, evidenced by a diastolic murmur. Identifying aortic dissection quickly is crucial. Let's discuss the diagnostic methods and tools used to diagnose this condition. Initial assessment includes an ECG, which may show normal or non-specific ST segment and T wave changes, and a chest X-ray that can reveal mediastinal widening. Definitive diagnosis is often made using CT angiography, which is the preferred method for stable patients. For hemodynamically unstable patients, transesophageal echocardiography, or TE, is preferred due to its rapid and detailed imaging capabilities. MRI can also be used but is less commonly employed in acute settings due to the time required. Once diagnosed, managing aortic dissection promptly is critical to improving patient outcomes. Initial management includes pain control with morphine and intravenous beta blockers like esmolol to reduce heart rate and aortic wall stress. If systolic blood pressure remains above 120 mmHg despite beta blockers, vasodilators such as sodium nitroprusside can be used. Type A aortic dissection, which involves the ascending aorta, is a surgical emergency and requires immediate surgical repair. Type B aortic dissection, involving the descending aorta, may be managed medically unless complications arise. Preventive measures include managing hypertension, regular monitoring for those at risk, such as patients with Marfan syndrome or Turner syndrome, and lifestyle changes to reduce overall cardiovascular risk. Acute aortic dissection can extend to various parts of the body, leading to severe and potentially life-threatening complications. These include stroke, due to involvement of the carotid artery, Horner syndrome due to the affected carotid sympathetic plexus, acute aortic regurgitation due to extension into the aortic root or valve, myocardial ischemia or infarction due to affected coronary artery ostia, pericardial effusion or tamponade due to blood entering the pericardial space, hemothorax due to blood entering the pleural cavity, renal infarction due to involvement of the renal arteries, intestinal ischemia due to involvement of the mesenteric arteries, lower extremity paralysis due to involvement of the spinal arteries. These complications highlight the importance of early diagnosis and management to prevent severe outcomes. Let's bring this information to life with a real-world example. A 50-year-old male with a history of chronic hypertension presents to the emergency department with severe tearing chest pain radiating to his back. His blood pressure is 180 over 110 mmHg with a 30 mmHg difference between his right and left arms. A chest X-ray shows mediastinal widening. Given the presentation, a CT angiography is performed, confirming an acute type A aortic dissection. He is immediately started on intravenous beta blockers and prepared for emergency surgical repair. Post-surgery, the patient is stabilized and educated on managing hypertension and regular follow-up to monitor his aorta. To wrap up, here are the key points we covered today. Aortic dissection is a life-threatening condition that requires immediate recognition and treatment. The strongest risk factor is chronic hypertension, with other factors including Marfan syndrome, Turner syndrome, and cocaine use. Common symptoms include severe tearing chest or back pain, and diagnosis is confirmed via imaging techniques such as CT angiography or TE. Treatment involves both medical management with beta blockers and surgical intervention for type A dissections. Preventive measures are crucial for at-risk patients. Complications of aortic dissection can be severe and include stroke, acute aortic regurgitation, myocardial infarction, and more. Early diagnosis and appropriate management are vital to improving outcomes in patients with aortic dissection. Don't forget to engage with our pre- and post-podcast quizzes to test your understanding of this critical topic. Thank you for tuning in to Med Madness. Stay healthy and informed. Until next time.